Well, I was diagnosed after finding a pea-sized lump um, prior to 2012. It was actually probably closer to 2009 that I found this little pea-sized lump. I mentioned it to my family doctor. He said, "Well, you're a bigger guy. You got a little gynecomastia going on, which is enlargement of the male breast. It's probably just a cyst or calcification. We'll keep an eye on it." And I hadn't been sick, and I had, been laid off from a job after a company moved, and I was on Cobra, then off Cobra, and not working, and then working as a temp and didn't have benefits, so I wasn't running to the doctor with every sniffle. Um, in 2012, in April, I was showering, found probably a ping pong ball sized lymph node under my left arm while I was soaping up. And I immediately started to tear up because I knew it probably wasn't good news. And I remembered that my mother had breast cancer. And I really wasn't sure how the two were equated. Um, but, I suspected the worst. Within about a week or so, the lymph nodes seemed to calm down and recede. And I had an ear infection and some ear blockage, and I had made an appointment with my doctor about 2 weeks after that point. It was already set up. And as they're irrigating my ear, I'm saying, "Oh, by the way, doc, what about that lump that we found a couple of years ago? That it's gotten bigger and it's ill-shapen or misshapen, and it hurts." And he said, "Well, let's take a look. Take your shirt off." And he was precepting some med students, and he immediately noticed that my nipple was retracted, kind of pulling down. I looked down at it, and I noticed that it was a little grayer than my right one, wasn't as pink and healthy looking. I knew that couldn't be good, and I knew him mumbling, nipple retraction to the med students wasn't a good sign. So he said, "Well, I want you to go to the breast center down the street at the hospital and get a mammogram and an ultrasound." So I did. As a follow-up to that, he had me see a surgeon that he knew down there who did a biopsy. The biopsy came back positive for breast cancer. I got a call from the surgeon late afternoon on Friday, May 11th of 2012. I told him, "Hang on, doc. I'm at Walmart. I'm in the parking lot just putting stuff away in the car. I want to get in the car and sit down before we have this conversation." And so we got in the car, and my spouse was with me. And I said, "Okay, doc, what's up?" And he said, "Well, it's not good. You have breast cancer." And I was in shock. And I immediately started to tear up and cry. My spouse started crying, knowing that it wasn't good news. And he said, "We're going to have to do surgery." And he rattled off, "We're going to have to do a mastectomy, and I'm not going to do a sentinel node biopsy. We'll just take the lymph nodes from under your arm. And I want you to come into the office. I'll have the girls call you in a few minutes and schedule something for early next week." Okay. So we went home crying, driving home, and I had an appointment that Tuesday to see him. He did the biopsy. He did the follow-up conversation about surgery, and I had printed up a questionnaire that I found online of what you should ask your surgeon prior to, at the time of surgery, and after surgery when you have breast cancer. And I got down to the question about getting a second opinion. Not that I didn't trust him, I just didn't care for him. And he looked a little discouraged, and he gave me the name of 3 female surgeons that were closer to home for me and suggested I see one of them. And it truly was, kind of hit or miss. eeny, meeny, miny, mo, who do I see? I picked a surgeon. They booked me for a 5 p.m. appointment that following Friday, I think it was. And they actually stayed with me there until 8:45, her and her medical assistant. They drew the blood for the BRCA testing. She drew out, an image of a breast and what happens during surgery. And she had her little 3D plastic model there on the table in the conference room. And she had basically 4 possible scenarios that she would consider as far as treatment goes. Well, I would do this, I wouldn't do that, blah, 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 whatever. And I said, okay. And my spouse is at work, so I asked her, I said, can I call and have you kind of repeat the highlights so we're both on the same page, which she accommodated. And she's very gracious about it. And the following day, I brought in my medical leave of absence paperwork from my job, and I had just gotten the job. Actually, I was working that October of 11 through March of 12 as a temp, and they hired me March 3rd, thankfully. So I got benefits, and noontime, I'm bringing in this paperwork, and the medical assistant hands me a checklist, and says, okay, on this day, you're going to go for blood work. On this day, you're going to have surgery. I've already booked in the plastic surgeon to scrub in on the surgery. This is the day you're going to come back for us to check you, and I'm like, didn't you guys even go to sleep last night? I mean, it's only noon the next day. You guys are amazing. So she really set the bar high. June 13th, I had a radical mastectomy with a sentinel node biopsy. Sentinel node was positive. So she took 14 nodes. 7 of those proved to be positive on the frozen sections before they closed me. And they installed 2 drains to drain off the serospangus fluid, from the surgical site. And I was in the hospital for 2 days. I went on that Wednesday, the 13th of June, got out the 15th of June, came home, arranged for a visiting nurse who happened to be a friend of mine who insisted that she be my visiting nurse, which was fine with me. And, the rest is history. I made an appointment with the medical oncologist that she wanted me to see and the radiation oncologist she wanted me to see. She really set up all the best doctors for me. And I was so thankful for that. She said she wasn't going to send me to somebody she didn't trust personally. And I really think that that's really important for any patient, to have a doctor they trust and have a rapport with, and that are going to look out for your best interests. She truly is a needle in a haystack when it comes to doctors. And here I am 5 years post-diagnosis, soon to be 5 years post-surgery on June 13th of this year. And I'm praying to God that I stay, NED, no evidence of disease, but realize that nothing is guaranteed. And I just try to live my life to the fullest every day and keep myself busy and active and help others. Breast cancer patients.